Welcome back to Houston Life. It is time to get proactive about your health. The Medicare annual enrollment period is now. It runs through December 7 each year. And this gives people a chance to make changes or confirm their coverage for next year. And joining us now on Houston Life is Lindsay Olaya with tips on how to make the most of your Medicare. Hello, Lindsay.
Good morning.
Thanks so much for being here with us. It's really good to get some advice on this. Especially for seniors and others who are enrolled in Medicare, why is annual enrollment so important?
It's very important because for most, it is the one time of the year that they can change their health care coverage. And so, as you mentioned, the annual enrollment period ends December 7th. And so you have a little more time to look at your health care options and really evaluate, does your current plan meet your health care needs as well as your financial needs?
Okay, so what advice can you offer to help make the process of choosing a plan easier for people?
Yeah, first I would recommend checking your current coverage. Making sure that your plan that you're currently on is going to cover your needs for this coming year. Every year, your healthcare plan changes, and so it's really critical that you review the plan that you're currently enrolled in. And then I would say again, look at your budget. Right, you know what is coming for the new year, and look at the cost on your current plan and see if it still fits your budget. That may be in the way of prescription medications. And then thirdly, I would say look at the out-of-pocket cost beyond your premium. A lot of Medicare Advantage plans, including those with United Healthcare, include really rich ancillary benefits like dental, vision, hearing. Some include transportation. And so take a look at those plans and see what is best fit for your coming needs.
Okay, awesome. Okay, and beyond understanding the key costs, what are some other important aspects to consider when enrolling in a Medicare plan?
I would say look at your network. That's very critical. The doctor that you see, your specialist, are they in that network? United Healthcare has one of the largest networks in the industry, and that's very critical because even if you have great benefits that are offered through your plan, if you don't have providers to access those benefits, they're not as meaningful. And then I would also say, again, look at those additional benefits, vision, hearing, dental, those are critical parts of your healthcare needs. And majority of plans include those things at either a low or no cost. And so it's really, a good time to review your full plan.
Okay, but is there anything that might surprise people when it comes to new benefits or features that they might want to take a look at for next year?
Yeah, absolutely. And 2025, United Healthcare is coming out with some new plan offerings, and those plans are tailored to specific needs. And so you may, want to look at what is new in your area. And so I say, educate yourself. That's critical. This is the time to do that.
Okay, that's awesome and very good to know. Are there any resources that people should be aware of if they're looking for support as they make their Medicare enrollment decision?
Yes, there's a lot of resources. If you're interested in looking at United Healthcare plans, I encourage you to go to the website, uhcmedicarehealthplans.com. If you want to look at multiple different plans from other carriers in the market, including United, you can also go to medicare.gov. That's a good resource to compare plan offerings in your area. And then if you just need education in general on Medicare, and you really don't know where to start, I recommend that you go to gettoknowmedicare.com. It is a great educational resource.
Okay, that's a very handy one to know. And Medicare Advantage is one of the options that people can consider, and I understand it's experienced rapid growth in enrollment. What is Medicare Advantage and what's driving the growth with that?
Yeah, you're right. Medicare Advantage is experiencing rapid growth because it packages the healthcare needs. And so if you have Medicare A and B, you qualify for a Medicare Advantage plan. And those plans often include prescription drugs. And so it's a nice package of your healthcare that's easy to manage with one card, with one carrier. For example, United Healthcare, we have what we call our U card, and it is your medical ID card as well as your rewards, your gym membership, all in one card. And so it really helps the Medicare eligible population not only access healthcare, but enjoy the benefits of their plan. And so, yes, you're right. Medicare Advantage is a growing option for the Medicare population due to that simplicity and really overall package of coverage.
Lindsay, thank you so much for taking the time today to explain that to us. Really, really valuable advice there. To find out more about United Healthcare Plans, visit uhcmedicarehealthplans.com.